What is fentanyl? For some, fentanyl is a lifesaver. It is a powerful painkiller that can offer relief from chronic and acute pain, but it also carries significant risks. That is because it is a synthetic opioid. It interacts with the brain in similar ways as morphine and other narcotics. If not used wisely, fentanyl can easily be misused, leading to addiction and even overdose. In this video, we will discuss in detail what fentanyl is, why people take it, its side effects, the signs of a fentanyl overdose, and how a fentanyl overdose can be treated. Let's get started. Fentanyl is a powerful synthetic opioid pain reliever prescribed to treat severe pain. It was initially developed to treat severe chronic pain and cancer pain. It is also commonly used as a powerful anesthetic drug for surgeries. Fentanyl has skyrocketed in popularity over the past decade due to its potency, strength, and availability. Fentanyl is considered up to 50 to 100 times more powerful than morphine and significantly more potent than heroin. It means it takes a much smaller amount of the drug to produce the same effects, making it easier for users to become addicted or overdose because of its high potency. That is why fentanyl is classified as a Schedule II controlled substance in the United States due to its high risk for misuse and addiction. Fentanyl comes in several forms, such as pills, patches, lollipops, or lozenges, but it can also be illegally produced as a powder or liquid solution. It is crucial to take fentanyl precisely as prescribed by your doctor to avoid potential addiction and overdose. It will help ensure you stay safe while using the drug and prevent potential harm. Fentanyl has become a widely used drug in recent years, despite its highly addictive properties. It is used for various reasons, including recreational use and medical treatments. In the medical world, fentanyl is often used as an effective pain reliever. It has also effectively treated chronic conditions such as cancer, epilepsy, and depression. Additionally, fentanyl can also be prescribed for postoperative pain and end-of-life care. Outside medical purposes, many people abuse fentanyl due to its availability. Fentanyl can easily be obtained illegally through the black market, making it a popular drug among recreational users seeking an intense high or just curious about its effects. Unfortunately, once someone starts abusing fentanyl, it is tough to stop due to its highly addictive nature. The popularity and availability of this drug have resulted in a surge in fentanyl overdoses and deaths in recent years. So despite its medical benefits, many people abuse fentanyl because of its potent and fast-acting effects, including intense euphoria. One dose of fentanyl can create a sense of euphoria and relaxation that can temporarily ease emotional distress, making it an attractive option for those struggling with the symptoms of depression and anxiety. The risk of addiction to fentanyl is very real, so using authorities such as doctors or pharmacists to prescribe the drug properly should be the primary avenue for obtaining fentanyl when needed. Fentanyl is a narcotic used for medical treatment and pain management, but it can have uncomfortable and dangerous side effects. Take note of the following side effects of fentanyl that you may experience while using it: nausea and vomiting, drowsiness or fatigue, constipation, confusion, disorientation, or hallucination, bloating, swelling of the face, arms, hands, legs, or feet, fast, irregular heartbeat, weight gain or loss, stomach pain, difficulty in swallowing, painful urination, anxiety, slowed breathing rate, loss of appetite, sweating, clamminess, or chills, rashes. In most cases, these side effects are short-lived and may go away after a few days of taking the drug. However, if they worsen or are persistent, your doctor may have to adjust your fentanyl dose or prescribe an alternative pain reliever. As we have mentioned, fentanyl is a highly addictive and dangerous drug. It is an opioid that users easily abuse. Once someone has become physically dependent on fentanyl, it will be challenging to stop using it without professional help. People addicted to fentanyl develop tolerance towards the drug, meaning they will need higher doses to achieve the same effect. It increases the chances of an overdose, as users may be unable to track how much they have taken. Additionally, people who are addicted to fentanyl often suffer from cravings and withdrawal symptoms when they attempt to stop using it. If you or someone you know suffers from a fentanyl addiction, it is crucial to seek professional help. Treatment is available and can be tailored to meet the needs of each individual. With proper support, it is possible to overcome an addiction to fentanyl and lead a healthier life. If you are unsure if you or someone you know may be addicted to fentanyl, you may look out for the signs and symptoms of a fentanyl overdose. The symptoms of fentanyl overdose can vary depending on the amount taken and your tolerance to the drug. Common signs of an overdose include severe drowsiness or loss of consciousness, muscle weakness, confusion, or shallow breathing, blue lips or fingernails, slow heart rate or low blood pressure, cold, clammy skin, small pupil size, seizures, dry mouth, memory loss, dizziness. If you think someone has overdosed on fentanyl, it is essential to seek medical help immediately. A fentanyl overdose can be fatal, so time is of the essence. Fentanyl overdose is a severe issue and can be life-threatening. Understanding what to do in case of an overdose is crucial for everyone's safety. The drug naloxone can be used to quickly and effectively reverse fentanyl poisoning, making it the first step of treatment in many overdoses. Naloxone reverses fentanyl's effects on the brain and restores normal respiration. However, due to fentanyl's potency and long-lasting effects, more than one dose of naloxone may be necessary to revive someone who has overdosed. Suboxone is another medication that can help with fentanyl addiction by aiding in rehabilitation. It contains buprenorphine and naloxone, which work together to reduce opioid cravings and overdose risks. When taken as prescribed under medical supervision, Suboxone blocks fentanyl's ability to affect the brain while lowering cravings associated with fentanyl use. In this way, Suboxone can be an invaluable resource for those seeking relief from their fentanyl problem. In addition to medical treatment, supportive care is also necessary for people recovering from a fentanyl overdose. It includes providing emotional support and helping the person build healthy coping strategies to prevent relapse in the future. Professional psychological help is also recommended during addiction recovery and should be sought as soon as possible. Fentanyl addiction is a severe and potentially life-threatening condition. If you or someone you know is struggling with fentanyl abuse, it is essential to seek help immediately. Suboxone can relieve opioid cravings and overdose risks while also helping the person build healthy coping strategies for long-term recovery. Find professional medical care today with the help of a Suboxone doctor to start your journey to a healthier life. Visit Suboxonedoctor.com.